Hello. For my final journal presentation for MN 668, I'm going to do a reflective journal going over the entirety of the semester, starting with what goals I set for myself at the beginning of the semester. Some goals that I had in particular were I did not have very many opportunities to completely conduct a visit from start to finish. Um, I didn't start with psychotherapy in my rotation. I started with the second course in the clinical rotation just due to the availability of my preceptors. So I wasn't really ready fully to be able to go through a complete visit from start to end in that first clinical rotation. Um, and in this class, I really wanted to be able to do that, to be able to go in, whether it be an inpatient room or be with a patient that's coming into the office and do the background information that was necessary to look into their chart, to see what's going on physically, and just to bring all of that together as a process, and then listening, interviewing, assessing, developing rapport with the patient, and then coming up with a treatment plan, and then charting that in the electronic medical record system. My preceptor allowed me to do that several times this semester. I felt like I was the most ready for it, more so than I had been previously, and I feel like I really got to experience that from start to finish. Feelings, prejudices, and biases that I experienced during my clinical experience, and how did I manage them? It is hard sometimes when you're working with patients that are really pushing for ADHD medications and they have not had a clinical diagnosis before the age of 12. It's hard to really deal with those patients as far as really looking at them with sympathetic and compassionate eyes, because sometimes that's the only thing that they're coming in and seeking. For me personally, the way I'm going to handle that, I already know where I'm going to be practicing, and I've just stated from the beginning, if a patient is on their intake form complaining that only of symptoms of ADHD, and this is adult onset, I will not see those patients at the beginning of my practice. The reason being is that controlled substances can really get people in trouble, and I just really want to be leery as to how often I write for something, and I don't want to just bring a patient into my office to send them to neuropsych testing. There may be another prescriber that is willing to evaluate them and go ahead and diagnose them with that, but initially I'm just not comfortable doing that until I get some more experience under my belt. And it doesn't mean that I'm not familiar with the DSM-5 criteria. It's just what my experience has been that I want to address. I really became more confident in the last term. My anxiety at the beginning, I was unsure of everything. And just depending on who my preceptor was and in situations I was in, and trying to remain humble, I do felt like I struggled with anxiety and self-doubt a lot more in the first 3 clinical rotations than I did in the 4th. I was very much more at ease, very comfortable with my knowledge, and comfortable with what I felt like was best with the patients. However, there were certain situations inpatient that I just had not had exposure to, where there were some very severe psychosis patients, and I was able to go in and see those patients confidently, but it is nice to have the collaborating nearby in those situations. As far as insights or understandings that I developed in my clinical experience, I just mentioned that there are hard stands that I'm going to take initially, um, in that who I will and will not take. I would also really like to be able to see adolescents. However, that's going to prove difficult for me because the physicians that I'm going to be collaborating with are not board certified in pediatric and adolescents. So my manager is working on that, but that's an insight that I didn't have coming into this, that I didn't know, that I know now, that I would very much enjoy working with adolescents, at least the age 12 and up. Um, and as far as reflective practice impacted you as a person, I'm reflective in general. I reflect on my days every day in the evening and through the nighttime, sometimes a little too much. So I don't necessarily know that this is something that I haven't already been doing or have done in the past, and I will continue to do so. So to answer the last question, yes, I will continue to use reflection in my future practice, in that this is something that I do every night. Did I meet my goals? How did I succeed? How did I fail? That's just been a facet of my personality since I was young, and just give me new goals for the next day to work on. So overall, um, that was my experience with the last term in clinical rotation. It was very good. Like I mentioned, I did have a lot more confidence. I feel a lot more competent. I know my resources when I don't feel competent, and who I can call on, assessment tools I can utilize, and just to rely heavily on that DSM-5. I'm pretty confident with pharmacology, although I do think I'll continue to brush up on that. But thank you so much, Dr. Rogers, for your time and for your lectures. They were always very beneficial.